we do see appointments as the nurses in my practice. So for, regular patients like diabetics, chronic kidney disease, various different conditions, we'll see for follow-ups. We'll do things like their blood pressure, place continuous glucose monitors, perform different diagnostics under the direction of the vet, provide advice on things like nutrition, medication, environment, lifestyle, that sort of thing. Mostly endocrine patients, I would say, and kidney disease patients are probably the ones I see most often.
And they can be the most challenging, can't they? Because really, I guess what you're doing in most of those cases is improving the quality of life for whatever time they have left, rather than curing them as such.
Yeah, absolutely. Working with the families to just maintain quality of life for as long as we can.
So here's an interesting question. Client says to you, but what is quality of life? How do you answer that? It's getting heavy for a Monday evening, isn't it?
It is, yeah, absolutely. So I would say that it's really the ability of their pet to be able to live what they feel is a happy, well-rounded life, not just their kind of physical day-to-day needs, but like behaviorally, emotionally as well. So I tend to direct clients to places like Lap of Love or the How Do I Know If It's Time resources, not necessarily because we're making decisions about end of life, because I think that if quality of life, in my opinion, is something that we should discuss earlier rather than later, so that it becomes a normal part of conversation and we're not bringing this up at a time where emotions are starting to run high. So I tend to direct them to that information, not to make end-of-life decisions, but so that they know what they should be looking out for and what they should be monitoring to see if there are any changes. So the usual stuff like eating, drinking, toileting, exercise, but also things like how they interact with their family, play, other animals in the home, expressing normal behaviour, that sort of thing.
It's interesting. It was a bit of an unfair question, I guess, and you answered it very well. We're not marking out of 5 because I don't know the correct answer to it. But the reason I asked was because I had 3 conversations today about quality of life with owners, and each one went a different way, because we're directed, aren't we, by the owners to a very great extent. And it led me to reaffirm something that I've maintained for a long time, that it's impossible to treat a pet on its own. We're treating the pet and only unit, aren't we?
Yeah.
And we're trying to work out a best fit for them.
Yeah.
And that best fit may be to do absolutely everything that veterinary medicine can throw at them to get their dog or cat or guinea pig or hamster better, or to do as little intervention as possible to get it to a happy state, if we can use that term.
Yeah.
And so we really just need to be asking our clients what they want, what their thought is. And I answer that each time the client said, how do we measure quality of life? And I always sort of deflect about, well, you tell me. But actually, it is quite true, isn't it? They all have their own ideas, and there is no right or wrong answer.
Yeah, absolutely. And like you say, so much of it is about managing not just the patient, but the whole situation and the family scenario and everything as well. Like, there were some really, really good papers, and they were published years ago, but it was some studies that I think were done at the RVC, and it was the apps that were used to assess quality of life in diabetic dogs and diabetic cats. And the clients were asked lots of questions about factors that impact quality of life in their pet. And the specific things that they were highlighting, actually, most of them were not to do with the patient. They were to do with things like going on holiday, how they were going to inject insulin, the cost of the treatment, leaving the pet with friends or family, that sort of thing, the impact it might have on the client's social life. So a lot of factors that clients think of when they think quality of life are not always strictly to do with the patient themselves. And I think that's another reason why we as nurses can do so much to improve not just quality of life, but also perception of quality of life by supporting clients with things like that.